Why is my tooth sensitive to cold?
Many issues can contribute to tooth sensitivity. The primary reason is a cavity. A cavity is basically a hole inside the tooth that communicates with the oral cavity. As a result, anytime you drink something cold or something hot, those liquids can get inside the tooth and result in sensitivity. Generally, the deeper the cavity, the more sensitive the tooth can be, as generally a tooth without a cavity has a layer of enamel that covers the inside of the tooth, that protects the nerve inside of the tooth, and as a result, a healthy tooth is not sensitive at all. However, once a cavity happens or once a hole occurs inside the tooth, the layer of enamel no longer insulates the nerve of the tooth or the inside layer of the tooth, such that whenever cold or hot stuff gets inside that cavity, it results in sensitivity, which can be extreme depending on how deep the cavity is. Generally, treatment for a cavity can be as simple as a filling, which requires us to remove the defective tooth structure, the rotten tooth structure, and any decay that's left behind. We generally then fill the hole with a white filling material that now seals up the nerve of the tooth, seals up the inside of the tooth, such that all sensitivity should be completely eliminated. A tooth can also become hot or cold sensitive due to occlusal trauma. Occlusal trauma occurs when a recent filling or crown is done by a dentist. If that crown and filling isn't adjusted properly, such that every time you bite down you hit that filling first, over time that tooth that was worked on can be bruised, resulting in pain upon chewing, and long term, if this isn't corrected, the tooth can become sensitive to hot or cold. To fix this is very simple. Go back to your dentist and request a bite adjustment. All they have to do is adjust that filling or crown, and once the tooth recovers, all the cold sensitivity and pain on chewing should go away. In some cases, especially during allergy seasons when patients have sinus congestion or pressure in their sinuses, this can relate to or cause sensitivity on the teeth, especially to cold. Sometimes whenever this happens, usually once the sinus issues clear up, the cold sensitivity goes away as well. In some cases, patients report sensitivity to cold, but when there's no detectable reason that we can find, we generally recommend Sensodyne toothpaste or MI paste, as these toothpaste usually contain agents in there that can desensitize the tooth over time. Generally, we recommend trying these toothpaste first, as they're a little bit more conservative, and if the cold sensitivity is still present, we generally reevaluate to see what else might be going on. If you have any other questions about why your teeth are sensitive to cold, please feel free to give us a call. We'll be waiting for your questions. Thank you for watching.